Hi guys, welcome back to the channel. So last class we have started with the fourth one, that was focal epithelial hyperplasia, which was also known as heck disease. और उसमें हमने देखा था कि वो वाइट सेसाइल रेज म्यूकोजल पैचेस होते हैं और लेबियल मुकोजा, बकल मुकोजा और टंग पे जनरली दिखते हैं. एंड दे आर पेनलेस एंड दे डू नॉट blanch, and they have an association with human papilloma virus 13 and 32. Okay. So last class we have seen the differential diagnosis for focal epithelial hyperplasia. Now coming to the diagnostic workup, biopsy to include an edge of surrounding normal appearing mucosa. मतलब biopsy करते हैं और जो normal appearing mucosa होता है उनका edge भी लेते हैं. Now coming to histopathology, it consists of acanthosis with broadening and elongation of ready ridges, which tends to anastomose. Okay, so it consists of acanthosis with broadening and elongation of ready ridges, जो एक दूसरे में anastomose होते हैं. Virus particles have been demonstrated within nuclei and cytoplasm of prickle cells. Changes suggestive of viral etiology may sometimes be seen in the form of coilocytotic cells with clear perinuclear halos or as nuclear changes that resemble atypical mitotic figure. तो वायरल एसोसिएशन कैसा है, क्यों है, या कैसे सजेस्ट कर सकते हैं, या वायरल एटियोलॉजी का सजेशन हम कैसे दे सकते हैं इन द फॉर्म बिकॉज कोइलोसाइटोटिक सेल्स दिखते हैं जो मेनली वायरल एटियोलॉजी में दिखते हैं एंड विथ क्लियर पेरीन्यूक्लियर हेलोज और या फिर एटिपिकल माइटोटिक फिगर दिखेंगे न्यूक्लियस में, न्यूक्लियर चेंजेस में. Now, the connective tissue is vascular and may contain a mild chronic inflammatory infiltrate. तो chronic inflammatory infiltrate देखने को मिल सकता है. Coming to the treatment plan, no treatment is indicated. Spontaneous involution over 3 years is the most common outcome, especially in children. However, longer periods of time up to 30 years have also been reported. Prognosis, when lesions spontaneously involute under exercise, recurrence is rare. तो recurrence भी rare होता है. Now coming to the fifth one, that was all about hex disease. Now coming to the fifth one, that is hereditary hemorrhagic telangiectasia, which is also known as Rendu-Osler-Weber disease या Osler-Weber disease भी बोलते हैं इसको, syndrome sorry. Coming to the clinical presentation and pathogenesis, it is an autosomal dominant trait of weakened capillaries in the skin and mucosa, seemingly due to defective endothelial interconnection. So ये autosomal dominant होता है और mainly there is a weakened capillaries. और वो क्यों होता है? Defective endothelial interconnections होता है. Clinically, patient develop telangiectatic capillary dilations within the superficial layer of skin and mucous membrane which always blanch on compression. तो उसमें blanching नहीं होती थी, इसमें blanching होती है. मतलब जब तुम प्रेस करो तो एक yellowness दिखेगा म्यूकोजा पे या स्किन पे, that is known as blanching. The genetic defect involves the endothelial cells. The result is an ultrastructural gap between endothelial cells. वो हम देखे थे कि interconnection में defect होता है. Now, the capillaries first appear normal, then after years of systemic vascular pressure, the capillaries spread and balloon into telangiectasis. पहले तो normal रहते हैं, लेकिन जैसे जैसे vascular compression बढ़ता है, they spread and balloon into telangiectasis. Telangiectasis characteristically do not become apparent within the individual until the individual reaches his or her upper 30s or 40s. तो generally ये 30s या 40s में ही prominent या apparent होते हैं. Now, once they appear, the lesion will expand in area and in number to provide symptoms of bleeding. Skin lesions are common on facial skin and on fingers, and oral lesions are most notable on the lips, tongue and palate. तो स्किन में सबसे ज़्यादा कहाँ पे दिखेगा? फेशियल स्किन और फिंगर्स में. और ओलर लीजन्स में कहाँ पे दिखेगा? लिप्स, टंग एंड पैलेट में. These are the area. Okay, that's all for today. We'll be continuing this in the next class. Till then, like, share, subscribe, and comment. Bye.